Use of acupuncture for treating patients with profound xerostomia. I'll present two patients. One is the result of high-dose radiation for the treatment of oral squamous cell carcinoma, and the other was the result of oral surgery that caused significant nerve damage. I have been using acupuncture very successfully in my practice for over a decade, and probably, like you, was very skeptical. Since that time, I am still amazed at how successful it can be. My goal today is that after watching this video and practicing placement technique, you will be able to incorporate this treatment immediately in your practice. I would recommend that you check with your local state boards to make sure you will not violate any local policies.
And I believe in New York it's legal.
I found that most states do not have any verbiage restricting the use of acupuncture as long as you are treating a defined dental condition. Colonel Van Meter, thank you again for coming this morning, and if you could, just tell me a little bit about yourself and what the condition that you had that initially caused you to develop dry mouth.
Okay. Critical care nurse by background and in the military for about 24 years. And while I was in retirement, I ended up having a sore throat for about a year or so. Went in and they diagnosed me with stage 4 left tonsil cancer, and it was into my lymph nodes here. Had treatment with radiation and low-dose chemo, and then afterward, of course, I was left with dry mouth from the radiation. So Dr. Schwartz, the ENT doc, suggested that I see you because you were doing acupuncture to help with xerostomia, or dry mouth.
Gennaro, could you tell me a little bit about yourself and what condition you had that initially caused you to develop dry mouth and a burning tongue?
I'm 33 years old. I fly B-52s in the Air Force, and I originally went in for orthodontics, and I had orthodontic surgery to fix that jaw misalignment. During that surgery, I received permanent nerve damage, and I'm completely numb on my lower lip all the way down to my chin, my teeth and my gums, and the bilaterally the forward 2/3 of my tongue are completely numb. And about a year after that damage occurred, my saliva production severely diminished.
Okay, so anatomically what had happened is when they did the sagittal split osteotomy, you had your third division, your trigeminal nerve that was severed to include the lingual division and the chorda tympani, which gives taste to the anterior 2/3 of your tongue. Could you describe how dry mouth affects your quality of life?
It's hard for people to understand who don't have it. You're so used to having saliva that it's just a natural thing. But every time you eat, you have to take lots of fluids with what you're eating to get fluid moist enough to be able to swallow it down. And just walking, going out and doing any type of exercise or activity, it's very difficult because the air dries your mouth as you are mouth breathing if you're doing any type of exercise or anything like that. So it really impacts your activities of daily living and that type of thing.
And how did you feel about the fact that you were being recommended acupuncture as a person based on science, as a pilot, acupuncture being new into Western medicine? Your thoughts, your initial thoughts?
Well, I was honestly pretty naive about acupuncture and how it worked at the time, but I was willing to try anything to see if I could get some relief.
So would you consider yourself skeptical at the time?
Not really skeptical, just I guess uninformed.
I believe in alternative medicine. I believe in a combination of Western medicine and alternative medicine to help clients and patients. So it wasn't a surprise for me. I'd had acupuncture before for other things, so I had some belief in acupuncture.
So your first appointment that we actually were going to treat you for it, what were you thinking that for that very first day that we were going to try using acupuncture?
It's probably more curiosity. You know, how does this work? Is it going to work for me? If it works, awesome. How is it going to improve my quality of life? So really more curiosity.
Could you remember that first treatment, the impact, the effect that treatment had on you?
Yeah, I was surprised at the fact that it felt like I was receiving more saliva, and one of the biggest things is that I had my lower lip and my tongue had a significant burning, and it seemed to be aggravated by the dry mouth, and that has pretty much gone away, especially in the tongue. I still get a little bit in the lip, but I was surprised at how quickly it made my tongue actually feel better.
Within the first 5 minutes, I noticed very much increased saliva production. And it surprised me that it actually happened so rapidly. So it was a very nice surprise.
That's great. Was it painful at all?
Not at all. No. People think because you've got these needles sticking in you that it's painful, but no, they're very thin needles. Don't even feel them.
But have you noticed a difference in the effect of the treatment and the effect of how the positive benefits that it has after the treatment?
It seems like it helped me out initially for just a short amount of time, 2 to 3 weeks. I think that's may have been when we had our next appointment. And it seems like it's been able to go a little bit further now. You know, I think now I'm kind of at maybe 4 to 5 to maybe 6 weeks before I start feeling like I'm drying up a little bit more, and you know, and then I get the same relief that I get every time I come back in and get the treatment.
One of your big complaints was the burning tongue that you had. Matter of fact, I think that was one of your most significant complaints.
Yes.
How is the burning tongue? Where are you there with that?
I mean, if it was at a 7 or an 8 when I came in, it's at a steady 1 or 2.
So
ever since then.
So very
yeah,
bearable in your mind.
absolutely.
Okay. At times you don't even think about it anymore.
Right.
Because anatomically, I could not figure out exactly what caused you to develop dry mouth. In my mind, it was the fact that you had lost the sense of taste with the loss of the chorda tympani, with that feedback mechanism to you know, the effects on the parasympathetic system, your brain not being stimulated correctly, so therefore the glands somewhat atrophying. Unlike cancer patients that they're getting radiation which destroys them. So anatomically, your glands should be healthy. And I think what happened is we have kind of turned them back on, and then we're keeping them on to continue the saliva. But what's different now for the appointments that we have versus that first appointment? You know, the difference between how it affects your saliva and how long it lasts.
It lasts longer for me than it did in the beginning, I think.